SLR test. Tell me when you're ready. You ready? SLR test. What we're going to do is we want to tick and see whether there is evidence of sciatic irritation. Basically, SLR is between 10 degrees and say 45 degrees. Okay, anywhere between there. If the patient complains of pain, we ask him if the pain is in the leg predominantly or in the back. If it's in the leg predominantly, this is indicative of sciatic irritation. It doesn't mean it is, but it's indicative. If the patient stops you because of back pain, probably not. Anything below 10 degrees, you have to look for something else that's not indicative of sciatic stretch. If the patient goes above 45, 50 degrees with the leg straight and doesn't bother him, usually there's no indication of sciatic irritation, but it can happen, all right? All right, so that's the first part of the test. Now let's say at 30 degrees it was really uncomfortable and the pain was down the leg. We go to the second part, the Lasek maneuver. Take the leg down a little bit, say 5-10 degrees, put the foot into dorsiflexion and slowly come back up. This should cause a lot of pain. If it's evident, if we've got evidence of, or if we have sciatic irritation, so do it very gently, don't cause a lot of pain. The minute the patient feels pain, you stop and you ask where it is. Third part is the bowstring test. Release all the tension on the sciatic nerve. Put the leg into flexion, both the hip and the knee, the ankle and dorsiflexion, slowly straighten out. And as the patient complains suddenly of pain, then we check the three strings. The medial string is the medial hamstrings, that's the semitendinosus, semimembranosus. We strum them and see if that's painful. If it is, then possibly the problem is hamstring. We check the lateral hamstring, the biceps femoris. We see whether that's painful. If the problem is sciatic, then those two probably will be painless. And then we strum the sciatic nerve, which is in the popliteal fossa. If that is painful, we do it very gently, because if the problem is sciatic nerve, this will be exquisitely painful. And we check that, and if that causes the pain, then it's also indicative of sciatic stretch. Okay, so that's the full SLR test, okay? Okay, so let's take a break. No, please don't.